Hello and welcome. I'm Dr. D.K. Geyer, here to help you find health in this toxic world. Our subject today is understanding and learning the negative or positive benefits of consuming alcohol. Beer, wine, and many spirits are produced through a fermentation process. Some spirits go through distillation process after they are fermented. But we know about fermented foods and beverages. They are revered for their health benefits. Foods such as kimchi, sauerkraut, yogurt, kombucha, for example. Beer, wine, and many spirits are also fermented foods, and they do contain some health benefits when consumed in moderation. Alcoholic beverages are ingrained in our society, but very few people know the actual facts about health benefits or health risk of consuming alcohol. So join me on this informative journey to learn important facts to help you enjoy an alcoholic beverage if you would like to, without severe health consequences. Let's begin with discussing beer. Does beer have any health benefits? Well, sure it does. Beer that is fermented twice, for example, a Belgian beer, contains a certain strain of probiotic that can help boost gut health. All beers contain some level of vitamins and minerals, and studies have concluded that consuming alcohol in moderation helps lower the risk of dementia, osteoporosis, and reduces stress. And less stress is always better. Many studies have also shown that moderate beer consumption does not contribute to kidney stone formation. In fact, it helps to clear debris from the kidneys. In addition, several other studies suggest that beer may also help to lower bad cholesterol levels. But drinking beer products produces negative effects when they are combined with medications, consumed in abundance, or used as a substitute for water. Some beers are low quality and contain multiple chemical or other unsavory ingredients. So if you are consuming in moderation a high quality beer, you may enjoy some of the health benefits without any negative health results. Here are some of the unsavory and potentially dangerous components that are found in some types of beer. The first is propylene glycol. It is derived from petroleum, natural gas, or, in some cases, vegetable bases. But high levels can produce seizures, other neurological issues, and complications in the digestive tract. Monosodium Glutamate, known as MSG, can be found in some beers, and it will produce high levels of heart palpitations, sweating, numbness, a normal allergic reaction to MSG. Some beers use genetically modified corn, rice, hops, sugar, and other ingredients, along with high fructose corn syrup. These ingredients can help increase the risk of diabetes, heart disease, obesity, cancer, kidney disease through ketoacidosis, arthritis, and even pancreatitis. So try to find a beer that does not include some of those items. Another one to eliminate is one that is using artificial food dyes. And be sure that your beer can does not contain BPA. It is an industrial chemical that lines the interior of the beer can. Overconsumption of beer can make you obese, lose your memory, have cognitive issues, cause liver damage, diabetes, and heart disease. So how do we handle recovering your health if you just happen to overdrink at a party? You want to begin by rehydrating. Look, every now and then, people have too much to drink. The difference comes when you are having too much to drink daily or too much to drink every other day. That's when addiction and severe health complications occur. If you're going out on Friday night to have 2 beers, that's a health benefit. It helps you relax, and less stress is always better. But overconsumption is as dangerous as over-consuming any other harmful product. If you enjoy drinking beer, a few minutes of research online can help you make some better health decisions. Check to see if the beer you drink is listed as PBA free. If not, maybe choose a comparable beer in a bottle or find one that is PBA free that you can enjoy. The majority of beer and soda manufacturers in the U.S. use BPA in all canned products. Because ingredients in beer do not have to be listed on the label, some online research is the best way to find out if your favorite beer is listed on the Never Drink This Again, or if it receives high praise from people who want to enjoy a beer and also enjoy good health. Let's move on and discuss wine. Red wine contains some powerful antioxidants proven to help reduce the risk of certain types of cancer, including colorectal cancer, ovarian and prostate cancers, as well as reducing your risk of depression, type 2 diabetes, dementia and Alzheimer's disease, heart disease, and high cholesterol. When consuming wine, drier red wines contain a higher amount of a powerful plant compound known as resveratrol. This compound has been proven in study after study to help aid in protecting against heart disease. Not all wines are created equally. When choosing a wine to consume, many people choose what they want for how it tastes. A sweet apple cinnamon wine versus a dry red wine might be tastier, but it is not going to produce the same health benefits as the dry red wine. The amount of sugar in wines also varies greatly among the different types of wine. So a quick check online and you can find out how many teaspoons of sugar is in a glass of your favorite wine. Other than some trace amounts of pesticides, herbicides, fungicides, sugar is the most dangerous component of certain wines. Wines made of berries or any type of fruits other than grapes also contain antioxidants, vitamins, and minerals. Now that we've learned that beer in moderation is not going to kill you, and that wine offers extraordinary health benefits when consumed in moderation, let's check out some facts about spirits. Spirits contain a higher content of ethanol, so these alcoholic drinks can impair all functions of the body when they are consumed in excess. Spirits contain less calories and less sugar than beer and wine. Straight whiskey and vodkas can offer some level of health benefits. They do contain some levels of antioxidants. Studies have shown that consuming straight spirits is much healthier than when they are mixed with sugar-laden cocktail mixes, juices, and sodas. Spirits promote relaxation and are proven to help reduce certain LDL cholesterol levels. Because of their higher alcohol content, consuming spirits should always be done in moderation. Alcohol, whether it is beer, wine, or spirits, is metabolized through the liver. Consuming alcohol in the 21st century has many differences from the past. The older guys and gals used to drink their whiskey straight or maybe over ice. But the idea for them of diluting a carefully distilled high-quality whiskey or vodka or scotch was just simply silly or crazy. The fact that they preferred straight whiskey over mixed drinks most likely helped to extend their life and help them enjoy an occasional drink without disastrous health benefits. Because soda today contains high fructose corn syrup, food dyes, and many other questionable ingredients, mixing them with a high-quality spirit, well, it simply just doesn't make sense for your health. It's tasty, but again, most people don't really think about what they're drinking, how it's made, or how it affects their health. They just want what is tasty. The other difference is alcohol was rarely ever consumed at the same time as eating a meal. Beer, wine, and spirits were consumed minimally, and most of the time it was consumed before going to bed and considered a nightcap. From champagne to a tequila shot, alcoholic beverages surround us in this society, and they are often offered as part of a celebration. Hopefully this video helped you understand that maybe there are a few benefits of having a beer, wine, or a nightcap. If you choose to consume alcohol, drink responsibly, stay hydrated, and never drink and drive. To your better health, wishing you the very best.
The content of this video contains the author's opinions, observations, thoughts, conclusions, and serves as informational and educational material purposes only. It is not intended as medical advice, medical diagnosis, or medical treatment. The author is not prescribing medical treatment nor attempting to negate current medical treatment. Should viewers choose to follow any of the author's recommendations without the supervision of a medical doctor, they are doing so at their own risk. Should viewers decide to implement any of this information in the video, they are solely responsible for any outcome. The statements have not been evaluated by the Food and Drug Administration. The products mentioned in the video are not intended to diagnose, treat, cure, or prevent any disease.